The main themes in breast cancer treatment today are really what we call de-escalation of treatment. So what that means is a way that we can offer less invasive treatments for our patients and achieve equal or better results as far as outcomes and as far as the patient's satisfaction with the treatment. Some examples of that would be that for many patients we can do certain tests on the tumor cells themselves and determine that the patient doesn't really need chemotherapy and should be able to take a pill instead. We also, for many patients, can give much less radiation than we would have 20 years ago. Instead of a 6-week course, they can maybe have a 1-week course, and just in the area of the cancer, not all the other healthy tissue. Surgery has changed dramatically in the past few decades. I mean, most patients can have a lumpectomy now, but more than that, they're able to have a lumpectomy with a beautiful cosmetic result, an incision that they can't even find a year later. And the patients that either choose to or need to have a mastectomy can have an equally beautiful result. Those patients, we can do the incision so that they're hidden and a great reconstruction. One of my favorite things is a patient will come back to me and say, Dr. Simmons, you know, I was having a mammogram and the radiologist couldn't tell which breast had the mastectomy because it looks so natural. So that's a great feeling, things we can offer patients today. Taking out a whole lot less lymph nodes than we used to and less surgery. So all that is much better for our patients, and we're achieving much better and more satisfying results for our patients as well. I think the most important message is to have screening and appropriate screening, because breast cancer caught early is almost completely treatable and curable, and screening really makes a difference.
We are very delighted for the last several years to have partnered with Clarien Bank, and being based in New York City and having a symbiotic and strategic relationship with 2 Ivy League medical schools, we take care of patients across a whole host of specialties and subspecialties, and we are available, of course, to also international patients and those individuals coming from Bermuda with their families. When any international patient comes to our facility, we start the process of supporting that trip before you even get on the plane. We are there to help support making appointments, meeting the right people, having the right conversations, and also closing the loop for when patients come back to Bermuda to making sure we are part of their recovery alongside their primary care physicians here. We view this as a partnership. It's bi-directional, and Clarien certainly helps us with those relationships both in the medical community as well as with the residents and citizens of Bermuda. We're very, very, very happy and excited to continue this very exciting partnership.